The monitor displays reflect the pressures at the tip of the endotracheal tube and the internal servo or drive pressure of the life pulse. If the life pulse is in standby and there's no patient connected to the patient box, the displays will all read 0. Once the pressure monitoring tube of the LifePort adapter has been connected to the patient box, the life pulse, in its standby mode, will begin to monitor the pressures being delivered by the conventional ventilator or oscillatory ventilator, or the manual resuscitation bag even, if you happen to be bagging the patient. These pressures are updated in the monitor display every 10 seconds while in the standby mode. The life pulse monitors the following parameters: PIP, or peak inspiratory pressure; PEEP, positive end expiratory pressure; MAP, mean airway pressure; delta P, which is the PIP minus the PEEP, roughly equivalent to tidal volume. It can also be looked at as amplitude. And finally, servo pressure. Servo pressure is the life pulse's internal driving pressure and will always read 0.0 while in the standby mode. Servo pressure is a very important feature of the jet ventilator, and it deserves a bit more attention. Servo pressure may be more easily understood if you think of it as flow. There is more flow required to ventilate a larger space or a larger patient. The importance of servo pressure can be stated thus. Servo pressure is the automatically controlled driving pressure or working pressure of the jet ventilator. As lung volume changes, servo pressure will change. For example, if lung volume increases, then the servo pressure will increase. It has to increase to ventilate a larger space. If volume decreases, servo pressure will decrease because it can hit the same amount of pressure, but it takes less flow to do it. Servo pressure changes can give you an early warning that your patient's condition is changing. So it's a good clinical tool for you to observe. For example, if you experience a high servo pressure alarm, it could mean that you have improved lung mechanics, perhaps the compliance or resistance is improved. You might have leak in any of the circuit tubing, jet or conventional, or an extubation. Low alarm may be degradation of lung mechanics. Maybe you have secretions, atelectasis, a pneumo's turned into a tension pneumo. You might even have a right main stem intubation. So the importance of observing servo pressure is that if it increases, it may be an indication of improved compliance and resistance, maybe a pulmonary air leak in the patient, maybe tubing has become disconnected on the jet or the conventional ventilator, possibly the patient's extubated. All of these things will cause increases in servo. Things that will cause a decrease in servo are worsening compliance and or resistance. Possibly you have an obstruction of the ET tube, either by mucus or the patient's tracheal wall. Maybe a pneumo is turned into a tension pneumo. Possibly the patient needs suctioning because his airways are filling up with mucus, servo decreases. Maybe a right main stem intubation. One less lung to fill means less flow is required, less servo pressure to ventilate the patient. Therefore, observing servo pressure changes can give you many indications that the patient's either getting significantly better or significantly worse, and can help guide your patient management decisions. When the enter button is pressed, the microprocessor will begin increasing the servo pressure from 0 to whatever value will produce the set PIP at the set on time and rate for a particular patient. Although it'll typically take a short time for the actual PIP to reach the now PIP, the displayed PIP will equilibrate slower because of the averaging characteristics of the display. Thus, it may take longer, maybe a minute or so, for the monitored PIP to reach the now PIP. When the monitored PIP is stable for 20 seconds, the ready light will illuminate. The ready light, again, is in the upper right-hand corner of the live pulse in the alarm section. The ready light indicates that the live pulse is providing ventilation at the settings you have requested, and automatic alarm parameters have been established. Remember, never walk away from the live pulse if the ready light is off. When the ready light is illuminated, it's an indication that all the safety parameters have been set and the jet can serve to protect the patient should an untoward condition occur. Make sure the ready light's on before you walk away. The jet valve on-off lights turn on and off in conjunction with the pinch valve that is located in the patient box. On means the valve is open. Off means the valve is closed. These lights are really just they kind of serve as a visual check on the status of high-frequency ventilation. Some people have gotten used to seeing the lights flicker as an indication that the jet is operating.